I'm therapist Kathlyn White, and my office is Carpenter House, and this is my therapy dog, Tally-Ho. And we're here today to talk about depression. Oh no, what a terrible topic, but I deal with people who have depression all the time. So the question today is, how do you know if you might have depression? So one of the first symptoms of depression is sadness or crying. So if you're feeling sad every day or several days a week, then that sadness is not normal sadness. That sadness is prolonged sadness that can be part of depression. Right, Tally? What do you say? Say, if you're crying, you're in trouble. Yeah, especially if you cry for no reason. Like you're watching a movie and you just start crying, or the kids are fighting and you just start crying and you just feel overwhelmed. That could be depression. Discouragement. Do you feel discouraged often? Does the future look bleak? Do you have days you look forward to, or do you just go from one day to the next? Oh no, that can be depression. You should be excited about your day. You should look forward to your day. That's normal. And people with depression, they don't look forward to their day. They wake up, they feel tired, and they drag through their day. Low self-esteem. If you do not feel good about yourself, if you do not feel good about how you look and how you present to the world, you may have low self-esteem, and that is always a symptom of depression. Most people wouldn't think about that, but it's always a symptom. Feeling inferior to other people, not quite good enough as that lady over there or that man over there. If you feel inferior and less than adequate, then that can be a symptom of depression. Guilt. Women particularly have way too much guilt. Are you feeling guilty? No? All right, then you're not depressed. But people with depression often feel guilty about things that they shouldn't feel guilty about. Whether they did or didn't do something, how they did it, what they said, what they didn't say, what they got done today, what they did not get done today. Guilt. If you're self-critical or blame yourself, especially for problems in your family, then that can be a symptom of depression. Indecisiveness. Trouble making decisions. That can be depression. Irritability. Irritability, just feeling grouchy, is an absolute, very frequent symptom of depression. People can often get in fights with people in their family. They can snap at people. They can be frustrated when they shouldn't be frustrated. But that is a symptom of depression that most people don't recognize. Loss of interest in life. You just don't feel like doing the things you used to do. You don't feel like going shopping. You don't feel like going to the grocery store. You don't feel like visiting Aunt Susie or your best friend. Loss of interest in the things you used to like can be a symptom of depression. Not feeling like playing with your puppy dog. That could be depression. What do you say, Tally? Loss of motivation. If you're in school, particularly if you have a kid in school and they just don't feel like doing their homework, or you're in a job and you just don't feel like going to work, you've lost your motivation to do things, or go to church. You've lost your motivation to go to church. That can be depression. Motivation is a big symptom of depression. Poor self-image. If you think you just don't look good and you don't feel like you look good, that can be a symptom of depression. Appetite changes. If you are either eating too much or if you don't feel like eating at all, either extreme can be a symptom of depression. Some people either gain weight or lose weight. If you've lost over 10 or 15 pounds or gained over 10 or 15 pounds, that can be depression, because there's depression-driven eating or loss of appetite. Sleep. Sleep is a major symptom of depression. Sometimes it's one of the first things that people notice is that they either are not sleeping like they used to, they have trouble going to sleep, they have trouble staying asleep, or they wake up too early. They're waking up at 3 or 4 o'clock in the morning. That is depression. So if that has gone for you, you need to see a doctor, even if you don't have too many of the other symptoms, because a change in your sleep habits is very, very important and should be checked out. But think about your sleep in relation to all these other symptoms too. Or if you're sleeping too much, it's called hypersomnia, which is sleeping more than 12 hours a day. Like Tally, she sleeps all day while I sit and talk to people. Sleeping more than 12 hours a day, hypersomnia, a symptom of depression. Loss of libido or loss of interest in sex, that can be a symptom of depression. It's not an inevitable part of growing older. If you're depressed, you're not going to feel like being intimate with your spouse or significant other. Hypochondriasis, a big word, but what it means is you're worried about your health. You're worried about your body. I have a headache. Do I have a brain tumor? I have a stomach ache. Do I have stomach cancer? Hypochondriasis is a symptom of depression, not necessarily just a disease unto itself. And lastly, if you have any kind of suicidal thinking, that is a major warning sign. People do not have thoughts of hurting themselves unless they're depressed. So if you have any thoughts of hurting yourself or another person, you need to seek professional help right away or go to the nearest emergency room. When I see people with depression, if they have that one symptom, that almost automatically makes the diagnosis major depression, because there are different levels of depression. And if you've had suicidal ideation, you absolutely need to see a therapist and talk to somebody right away. Please don't wait. Untreated depression is bad for the brain. It actually shrinks your brain. So you want to see someone, you want to consider getting on medication, and you want to talk about what the roots of your depression may be. It may be the family that you grew up in. It may be abuse. It may be a rape. It may be relationships that you had with people in high school. There are all kinds of situations that can cause depression, but there's organic reasons for depression, that you just inherited it from your family, unfortunately. So whatever the reason for depression, I encourage you to get help. Don't put it off. There's no need to suffer. This is therapist Kathy White and Tally Ho, my little therapy dog, and saying goodbye and have a wonderful day.